And we are live from WMBS 590 AM, 101.1 FM. We are joined today by Pete Krekel. Pete is the clinical director of clinical services.
That's
right?
correct.
Director of clinical services at Nickman's Drug, right here in Uniontown, and in many locations actually across Fayette County. And this is a brand new show, and we are just getting excited. I'm excited to have you here, Pete. Welcome.
Well, thank you very much, and I'm more than excited to be here. My name's Pete Krekel. I've been a pharmacist, as you can tell by the gray hair, for a while, 44 years to be exact. Graduated from the University of Pittsburgh School of Pharmacy in 1981 and have practiced independent pharmacy my entire career.
Wow. So in your career, you said 1981, you can do the math. You've been a pharmacist for quite some time.
For a very long time, and a very happy pharmacist. You know, Josh, a lot of my colleagues, as there are fewer and fewer of them practicing, have always said, I practice fantasy pharmacy. Nobody can have it that good. Nobody can have it as good. But I have had it that good for 44 years because I practice independent pharmacy. I graduated in 1981. I'm originally from St. Mary's, Pennsylvania.
Okay, so Pennsylvania guy.
Oh, Pennsylvania guy, Pennsylvania licensed, and that's why you can't get rid of me. And I've been from 1981 when we graduated. Then my wife, Denise, is also a pharmacist. She graduated pharmacy school in 1981.
Okay.
Her maiden name is Kibitsky, a good Fayette County name.
Okay.
Her family is from Smock, Pennsylvania.
We know Smock.
And we got married the 4th of July. She makes life easy for me. Picks a day I can easily remember.
Very helpful.
And so we got married, and on August 12th, we got the note from the State Board of Pharmacy that we both had successfully passed the licensure exam. And it's been fun ever since. I started working for Rite Aid for 6 months. And not that I was going to originally work for just 6 months. I thought this could be a long-term thing. And as the store got busier, because I would engage more and more patients, I reached out to the district supervisor and said, I need some more help. I said, the paperwork and we're doing more, the volume's increasing. And he said, Pete, I've watched you practice. You quit talking to those patients.
Because he knew where your time was going.
And you will have plenty of time to do our paperwork.
I gotcha.
I came home that night and I looked at my beautiful bride, who would have been married by then, probably 3 or 4 months, and I said, honey, I think I made a mistake.
Yeah.
Not on July 4th, but maybe going to pharmacy school. I said, I can't put my fingers on it. I just don't like this. This is not what I want to do the rest of my life.
Right.
So I said, maybe I'll go back to Pitt, pick up a PhD, and teach. Teaching is definitely my first love. That's why I'm just so jazzed that we can do this kind of a program here for our people in Fayette County. So I was up to St. Mary's to my mom and dad's house, and with my wife, it was a Sunday afternoon, and the phone rang. The phones, those square boxes on a wall that would ring, and you would pick them up not knowing who it was.
The old landlines, yeah.
Yeah, the old landlines. So mom picked up the phone, and she says, oh, Pete, it's for you. It's your mother-in-law. And so my mother-in-law says, Peter, I am not meaning to meddle. Well, when your mother-in-law says she's not meaning to meddle, she's fixing to meddle.
Yeah.
So I said, yeah, what's going on, Mom? She said, we were at the Cop Drug Store in Hollidaysburg, and they're looking for 2 pharmacists, and I know how unhappy you are at the Rite Aid. So we, Dan and I, her husband and I, talked, and there's 2 openings, one in Tyrone, Pennsylvania, and there's one in Hollidaysburg. They'll have room for both of you.
Wow.
So that night I said to my wife, I think this is it.
Yeah.
So I picked up the phone a couple days later, and I called the owner of Cop Drug Store. Cop Drug Store is a 10-store chain in Blair County around the Altoona area. So I talked to him on the phone, and he'd just been recovering from some surgery. And I said to him, I was president of my class at Pitt for 3 years. I was president of the student council for 2 years. Didn't tell him that, but I wanted to get that impressive resume in his hand, because everybody knows you need that impressive resume in their hand.
Of course.
And he said to me something I'll never forget, and I still didn't forget it. He said, anybody married to Denise Kibitsky has to be all right. Oh. When can you start?
Wow.
I knew at that very moment that anything I'm ever going to accomplish in this profession would be because of the wonderful woman I've married. And we've been married 44 years.
That's awesome.
And have had a great time. But I've always known that. I've been very, very blessed to be able to have someone like her. So, of course, connections. At Cop Drug Store, worked there for a while till I saw he was ready to sell to Rite Aid. But one of the pharmacists at Cop Drug Store taught at St. Francis University, and he gave up the position, and he said, "You'd be great at it." So I applied for it, and I had interviewed against 3 people who had their doctorates, and I said, "But I will teach them street smart stuff that you need to know." And they hired me, taught up there for 16 years, and have had a really great time. So there's a lot of educator in me. I've been teaching for 16 years, but all along practicing community pharmacy,
Yeah.
because that has really been my love. So I taught up there for 16 years. And one day the phone rang, and this time it was a cell phone. Picked it up, and it was my daughter Gretchen. And Gretchen is also a
Pharmacist?
and her husband is a
Pharmacist?
correct. You
Wow.
are. And
It's a family affair.
She teaches at WVU.
Oh, close
Okay,
by.
Very close. So she's a WVU kid, and she started teaching there. And she said, "Dad, you've always wanted to work close to where we live," because they had at the time, he's a 4-year-old son. And I said, "I would love to live by Luke." So we started looking. She said, "I found a job for you in Uniontown, PA." I said, "Uniontown? Well, that's terrific." I said, that'd be cool. It's in Pennsylvania because it's only licensed there. And you could live in Morgantown by us. I said, "Okay, sounds
Yeah.
reasonable." So I came down and interviewed with Jimmy Nickman and talked to him and his mom. But Jimmy said something to me that stuck in my mind at my interview. He said, "I want you to take care of my people in Fayette County."
Wow.
He said, "Fayette County has been so good to us, the Nickman family as a whole, and I just need to give back. We already do free delivery. We do all of these really great services to help our patients." But he says, "I need to give back to this area." So he hired me, and we looked high and low all in the Morgantown area to be able to live closer to Gretchen. And there was an empty lot next door to them, wouldn't you know? And so we reached out to the contractor. My wife came up with a house plan. They built it. So my 9-year-old grandson, he's now 9, and we've been blessed with another one. He's 2.5. I have 2 grandsons that are my next door neighbors.
Wow.
So again, fantasy pharmacy, but
You're right.
fantasy living here, because everyone has taught and given me the opportunities to teach and to do so much. Some of the things that we've done to fulfill Jim Nickman's wishes, and this all goes back to my teaching days at St. Francis, and I also teach online for Free CE and Achieve CE, continuing education stuff for pharmacists, so it's really, really current. We develop flyers. Lots and lots of flyers. I have 30 different flyers. These 2 we're going to talk about in the upcoming episodes, Lyme disease and poison ivy. But everything, Josh, from pediatrics, the smallest, to why old people smell funny. And it's more personal hygiene, but I'm going to teach you about denture care and things like that.
Sure.
So I have lots and lots of stuff in all of our Nickman stores. Every one of the stores has a rack there that has all of these flyers in, and we encourage our people to go in and help yourself.
Yeah.
That way you can go home and have something to read and to understand about your particular health condition.
Right. And I think that based on our conversations we had kind of leading up to this first show, being a part of the community, being a part of the people is important to Nickman's, but it's also important to you. Seems like that kind of tied right in with your philosophy and was probably one of the draws that brought you back.
It definitely did. It definitely did. I'm not going to lie to you. When we graduated in 1981 in April, we were married the 4th of July. So what's that tell you? 2 poor college kids just graduated.
Yeah.
And on our honeymoon, we honeymooned in Pittsburgh, and we spent the last 2 days of our honeymoon in Smock.
Okay, I gotcha.
At Grandpa and Grandma's
Yeah,
house.
of
and
course.
We had, just a delightful time. So family has always been really, really important to my wife and my family and all of our extended family here in Fayette County, but most of all to the Nickman family.
Yeah. And so you were able to come back here and kind of make that move. And you said Hollidaysburg, you were out there for how long altogether?
Altogether, we lived in Blair County 38 years.
Okay.
So I worked 26 at Cop Drug, 12 at Thompson Pharmacy. Bill Thompson had 5 stores. And what he did with me is he put me in a doctor's office 2 days a week with some of my PA former PA students who were practicing. So I got to do like a lot of the general medicine, a lot of patient interaction. And I'll tell you, if I ran the zoo, I would figure out a way to put a pharmacist in every single family practice doctor's office just to do things like patient care, look for the drug interactions is a big one. And most of all, just make sure people are taking their medications. That's
Right.
a big deal.
Yeah, and I think that's something you and I talked about as well, that sometimes the missing link in the healthcare continuum for folks is that relationship with the pharmacist. It's an important one.
Exactly. And the next episode that we air is going to be about pharmacist and patient interaction and talking about insurance companies. So there is a whole lot to discuss as far as what we do. Unfortunately, we wear our starched white lab coats and we hide behind a big curtain with, or a counter with at least 3 to 5 phones ringing, and it's always crazy, but we always have time for you. It's busy, we know, but to answer your questions and to take care of it, again, this is what Jim Nickman wants. He wants his pharmacists to be hands-on in working with patients. And even things like these flyers, they are my distilled lecture notes from St. Francis University. Made them patient-friendly, of course, so we don't say things like negative ionotropes and things like that, but we do put them in patient-friendly language so you can take something home and read about it and ask if you have questions.
Right. It's just another opportunity for that touch point with the patients and with the community to let them know, here are the things that you need to know. It's not the end all be all. You can obviously always call your physician if there's something wrong, but here's some guidance.
Right. And that's what we are. You know, we are the triangle between the doctor, the patient, and then, of course, the pharmacist. And that triangle, we want to keep as tight as we can. And unfortunately, some of the insurance companies, which we'll talk about next episode, don't want that to happen. They want everything channeled to their business where they have no established relationship. When you come to Nickman's, you get more than a bottle of pills.
Yeah.
You know, you get pharmacists, and the colleagues that I've worked with are just amazingly bright, amazingly smart, and amazingly caring and compassionate. There isn't a pharmacist in this Nickman's chain that I wouldn't roll my sleeve up for to give me a shot, or if I was a patient, had a question and want them to take care of me.
Wow, that's really amazing, and that's part of that whole community feel of Nickman's. If you're just joining us, you are watching and listening to WMBS 590 AM, 101.1 FM. I'm Josh Krysek, here with my new friend Pete Krekel. He is the Director of Clinical Services, the pharmacist at Nickman's Drug, right here in Uniontown, but also at locations across the area. It's a brand new show, our first episode. It's an introduction to Pete, and we're really going to dig into some pretty cool topics over the coming weeks and months, and I'm looking forward to it. Now, Pete, I know we talked about the flyers that you created, but that's just one aspect of what you've been up to. I know you've been making some visits and doing some different things in the community, too.
We certainly do. And again, this goes back to Jim Nickman. Jim Sr. started this business back in 1974. I'm not going to say he's a whole lot older than me, but I would have just passed my driver's test in 1974.
Okay.
And Jim was opening a drugstore here in Uniontown. And Jim's family were, Jim Sr.'s family were a bunch of businessmen. And he, like me, has excellent taste in women. He married Karen Nickman, who is also a
Smock? Fayette County? Pharmacist?
Pharmacist from Brownsville.
Oh,
Very
my
good,
goodness. It's
yes.
all pharmacy
So-
and from Brownsville.
And
So,
from
yeah,
Brownsville.
I gotcha.
Oh, we cover all of Fayette
I
County
gotcha.
here. And Karen and Jim started this business in 1974. And then a few years later, we're blessed with a little boy named Jimmy. And so that little boy now is my boss. He's the guy that interviewed me. And they started a business out there in Lamont Furnace.
Mm-hmm.
I just showed I wasn't from Fayette County, right?
Lemont.
Lemont Furnace.
There you go.
All right, so they started it out in Lemont Furnace and just tore the place apart. Just did an incredible job. Jim Sr. is not only a very, very bright pharmacist. I mean, we talk half-lives and we talk medication, Suboxone, buprenorphine, half-lives, steady-state equilibrium. I mean, Jim Sr. is as sharp as any of the pharmacists that I work with.
Mm-hmm.
And he's, like I said, a little bit older than me. And so him and Karen started it. And then Jimmy, his son, did not go to pharmacy school. Okay, he's a businessman, which probably is the best recipe for success for an independent pharmacy, because he pays attention to the numbers, the dollars. He negotiates leases. He's I hate to say this, but he's probably the brightest guy I've ever worked with.
Wow.
When I see, for an astute businessman, he's got it. You know, we just saw, unfortunately, the demise of all of the Rite Aids.
Right.
I often wonder, thank God he doesn't work there, but if Jim Nickman had that level of influence with them, and if Rite Aid's people had the ability that Jim does, they'd probably still be in business. He is just amazing at what he does in providing, you know, the products for us, manages inventory like no one else does, and really a very positive guy, and again, a local kid. Everybody knows the Nickman family. So they started out in 1974. Jimmy graduates, number one in his class from Carnegie Mellon University.
Is that all?
Yeah, that's it.
Yeah.
I think I know why he's pretty good at business. So, interestingly enough, when we were talking about Jimmy Nickman wants this to be not advertisement. He wants education out of this. So he says, you know, he wants to provide education to his people. And, you know, when I think about it, Jim's people are our people too. You know, my wife's family, I said, is from Smock, so the Peskys, the Kibitskys, the Taraseks, Brabecks, Bozaks, Petruses, Pliskos, they're all still,
They're all Fayette
their
County.
families are all in Fayette County, and still many of them living in Smock. So this isn't just Jimmy Nickman's family. This is my family and my wife's family as well.
Yeah.
So we are going to provide education as best as we can, and that's what we want to do. So the Nickman family, as we said, started this whole process in 1974, and they've switched warehouses to get better prices on medications. I mean, very, very, very attentive and very intuitive. In 2001, after Jimmy graduated, they bought the store in Connellsville, opened that in 2001, and then in 2012 they bought the store in Fairchance. And I think our people from Fairchance remember Dave O'Neill. Dave O'Neill was a classmate of mine. And Denise's, of course. And in 2013, they bought the Masontown store. 2014, they bought the Hopwood store. And so Jim could give his mom, Karen, a little bit of breathing room. He took 10 years off from buying drugstores. And now recently, in 2025, they opened the Grindstone/Brownsville store. The mailing address is Grindstone, but Karen Nickman's from Brownsville. She says it's the Brownsville store.
Okay.
And 2025, they also bought the Rite Aid in California, Pennsylvania.
Okay.
So we stepped out of Fayette County by a couple miles.
Yeah, but that's still, I mean,
Yeah,
right on the edge.
it's all Fayette County.
Yeah.
We don't care where they drew the line.
Right.
So that's kind of where we are with the Nickman families. We have 7 stores. We've got lots of pharmacists, and all along, whether it was Jim Nickman Sr. coming in 1974 and 75, opening his drugstore after hours for a kid with an ear infection, to sitting here at the WMBS studio, our goal at Nickman's has always been to take care of that patient. But thanks to the technology we have today, it's not just a one at a time type of patient. We can reach out to many of them. And that's what we're going to do with this program. We're going to educate. We're going to teach a lot of things. And I really want our audience to be engaged too. Obviously, you have a very robust website. That's how I got a hold of you pretty quickly. And if there's a topic you want to cover, if there's something you want to cover us to cover on this, my title is really Professor Krekel. I'm not a doctor, okay? I did not graduate with a doctorate in pharmacy, but I am considered to be an adjunct assistant professor of pharmacology, retired at St. Francis University. But my latest teaching gig, I'm now teaching at Pitt, filling in for maternity leave. And again, I'm a generalist. My daughter, who is one of the immunization queens, Gretchen, was one of the 5 ladies in West Virginia that got the whole state immunized, all other nursing homes immunized. She was one of the 5. She appeared on BBC. Yeah, it's a little bigger than WMBS, but just a smidge.
Yeah.
But Gretchen was interviewed on British Broadcasting System, and they do an incredible job there as well. So my wife also worked as a pharmacist. She worked in a clinic up in State College, where my wife is pretty much singly responsible for most of Center County being immunized for COVID. She reached out to the health department. She was running 2,400 shot COVID clinics on a Saturday afternoon up in Center County.
Yeah.
So what I don't know, I know lots of people who do know. So here's what I am. I'm a generalist. I know this much about this much, whereas my daughter knows this much about a very narrow spectrum. But the good news is I have her cell phone. And the other day when I said, Gretchen, I need the names of a couple of those brand names for the 65 plus flu shots, Gretchen took care of me. So it works out very, very well.
Yeah, and those relationships are pretty cool. The fact that it's all in your own family, too. In addition to you having that access, it's your daughter.
Yeah, exactly.
That's exciting.
She can't say no.
Yeah.
So it is. We have a very fun pharmacy family. My son-in-law Mark is one of the opioid experts in the state of West Virginia. He does a lot of national conferences and things like that. Things that hit really hard here in Fayette County, and we're going to talk about that in an upcoming episode too.
Good.
About opioid abuse, Suboxone, naloxone, Narcan, one of my favorite drugs to dispense. And again, it all comes back to Jim Nickman saying, I want you to take care of my people in Fayette County.
Yeah. And I know that we talked too, as we were kind of preparing for this first show and getting things started, you visiting the community is also not new. I mean, this show is new, but you visiting senior centers, talking to them about these things, these flyers that you have, they're not just available right there. You actually have been taking this education out, and now this is another way you're going to try to reach people.
We're going to reach more people. I said I was the heartthrob of the buckskin, what is that, bullskin.
Bullskin.
The Bullskin
Yeah.
Township Senior Center. I was just up there on Thursday. I do some kid magic. I did a bunch of magic with them. Taught them all how to do stroke assessment. That every one of those people up there at that senior center can now assess someone for a stroke with the accuracy of about 90 to 95% of what a neurologist can. And we're going to talk about that in a future upcoming episode as well. We have some really excellent health care here in Uniontown, and you and I have talked about it with your previous position at Uniontown Hospital. We have a lot of top-notch health care here. Certainly, I think so in the pharmacy business. But when I see our local providers that have been around for ages, it seems like, as well as a very beautiful hospital here. The people in Fayette County, you're in a really good place.
Yeah, I absolutely agree. And I think that places like Nickman's and having those independent pharmacies that still exist kind of add a nice balance to the corporate pharmacies that are there. And one of the notes you have here, and I just wanted to make sure we touch on it, Jim Nickman and the Nickman family, they allow you to make home visits to provide vaccinations.
Yes.
That's amazing.
I've done that, and we've had patients with Parkinson's disease, and it's such a struggle for them to get the patient into a wheelchair, down the ramp, into the bed. No, I'll just go to their house and do it. And again, for the very, very seriously ill ones, he wants me to do that, and I have done home visits for COVID shots and flu shots as well. I've worked with some special needs kids to make sure that they were calmed down and comfortable when they got their shots, and have been really blessed to be able to do that kind of community outreach, whether it's going to senior citizen centers. Out in Hopwood, I taught the kids about Mr. Yuck. Mr. Yuck means no. And had a really good time teaching the little kids at the nursery school about that. So anywhere from nursery school to Bedfast senior citizen, the fact that I work for Nickman's allows me to, and my colleagues and all of my other colleagues, to what we say practice at the top of their license to do a really good job.
I think that that's really key, though, too. I think that kind of shows where Nickman's heart lies, and our listeners and viewers are going to learn that over time from hearing from you. It sounds like they're really community-minded, but those home visits aren't necessarily something that's very common these days.
No.
Yeah.
No, it's very hard to find that, somebody to do that, because first of all, pharmacist by law is not allowed to leave the building. Okay, so even if it was a lady across the street next door, none of our pharmacists can really legally run across and do that. So that's kind of where I have filled in and done that. But those are, again, all things that we are reaching out to the community to really take care of them.
Yeah. So if you're just joining us again, we're getting close to the end of our first episode here with Nickman's Drug. Pete Krekel, he's the Director of Clinical Services. He's the pharmacist there. This is a brand new show. We're going to be coming to you a couple times a month and establishing a cadence with you, and we're looking forward to it, talking about all things pharmacy, all things health, and we're going to rely on his 44 years of experience, the generosity and goodwill of Nickman's, to just kind of talk about the things that people need to know. And I know we're going to get into some pretty cool topics coming up in the coming episodes. Insurances, I imagine we'll probably talk about immunizations at some point.
Yes.
All those types of things. And Pete, I've had a great time already in our first episode, and I hope you're enjoying yourself too.
I'm having a great time. Put a mic in front of me, and I'll have a great time every time.
Yeah, awesome. Well, again, thank you, Pete, for joining us here for our first episode, and we will catch up with you next time here on WMBS.
Thank you.